Welcome everyone. Today I'd like to present my study, Military Mental Health During the COVID-19 Pandemic, Comparative to the Civilian Population, or in layman's terms, military versus civilian coping during COVID. First, we'll take a moment to go over a brief history of pandemic-related mental health effects. Medical records first note mental side effects during the Russian influenza in 1889. Records show a sudden onset of symptoms ranging from uncontrollable weeping, insomnia, nervous disturbances, and suicidal tendencies. During the Spanish influenza, Dr. Karl Menninger begins to study the observances of mental illness he sees in patients, with a 5-year study which eventually concludes that the influenza side effects, as he called it, are not usually permanent. Dr. Julius Althaus notices that you don't have to be infected to have psychological symptoms, and that people were turning to alcohol as a coping method. Other pandemics had similar findings, with SARS and MERS patients showing signs of confusion, insomnia, anxiety, depression, and impaired memory, as has COVID-19. The 2019 Substance Abuse and Mental Health Services Administration annual report showed that although alcohol use was going down, it was still high, with 60% of respondents over 12 years old admitting to drinking in the previous month. However, mental illness and illicit drug use were on the rise, and even more concerning was the co-concurrence of illicit drug use in those who were showing mental health issues. Military members are already at risk for mental health concerns due to the nature of their job. Being wounded, exposed to the death of others, or enemy fighting is related to negative psychological outcomes, even more so if allies or non-combatants are involved. Even being responsible for an enemy death is still significantly related to PTSD. The military community also typically holds strong stigmas attached to receiving mental health services, making it less likely for them to seek out help. 25% feel that mental health care is ineffective, while that number rises to 38% for the Marine Corps, an especially concerning statistic given that the Marine Corps is usually one of the first branches to go into direct combat. Concerns about career progression, command support, blame assessment, effectiveness, and perceptions of weakness underlie this stigma. So my hypothesis was that the military community would be more negatively affected by the COVID-19 pandemic, given that they're already at risk, and that substance abuse would be indicative of COVID-19 related strain in mental health states. Participants were recruited via the University of Baltimore Research Pool, the online participant platform Prolific, the Bob Parsons Veterans Center, and social media platforms. We received 341 surveys, 32 of which were incomplete and excluded. That left me with 309 participant surveys. This scale is the instrument used to allow participants to identify their states pre and peri-COVID. Items were pulled from different instruments used to assess worry, happiness, loneliness, depression, and anxiety. Statistically, items were used to create subscales for happiness, depression, loneliness, and worry. Each of these scales had a Cronbach's alpha of at least 0.79. Loneliness, depression, and worry items were combined to create an overall negative affect scale, which had a Cronbach's alpha of 0.91. Using these scales, I computed pre- and peri-composite values for each variable. We also asked questions regarding pre- and peri-COVID drug and alcohol usage. Change scores were created to measure value differences between pre- and peri-COVID periods. Of the participants, 164 identified as male and 136 female. The majority were white, followed by Black, Latinx, and Asian ethnicities. Approximately 38% had been quarantined once, with nearly 19% being quarantined 3 or more times. 78% had not been diagnosed with COVID, and the average age was 31 years old, and 171 members were affiliated with the military. The pre-COVID-19 self-reports show that aside from worry, military and civilians have similar ratings on the emotional scales. Alcohol usage is similar, although military members use much more tobacco than do civilians. Civilians also use much more non-prescription drugs than the military. The overall negative effect was significantly different between the two populations, with civilians feeling generally worse. Peri-COVID rates show a little shift. We can see that the variability between civilian and military population has a bit more gap now. with civilians feeling less happy, more worried, lonely, and depressed. Alcohol levels also showed more of a gap, with military drinking more than civilians. Tobacco use is still much stronger for the military, and non-prescription drug use is still higher for civilians. Here, the overall negative effect is still significant, with the civilians feeling worse than military members. So our results show that alcohol use is significantly higher between the pre and peri-COVID time periods. Tobacco usage went down significantly for both populations. There was no significant change in non-prescription drug use, although civilians were taking less non-prescription drugs peri-COVID than they were pre. Civilians are feeling lonelier and are more affected by worry, and there were significant changes in overall negative states. To go back to the hypotheses, Hypothesis 1 was not supported. The military are doing better than civilians. And Hypothesis 2 is also not fully supported. Alcohol use went up, but tobacco use went down, and civilian non-prescription drug use levels also dropped. The good news is that the military lifestyle doesn't appear to negatively impact the lives of military members during a pandemic. This could be due to PTSD, post-traumatic stress growth, which is when we're faced with difficult situations and overcome them. We build a belief in our capacity to handle stressful events and resiliency, in turn growing from adversity. Military members could simply just be more habituated to sudden changes and a lack of situational control. And the military does offer a great deal of internal social support among command groups. For everyone, the good news is that going through a pandemic causes us to be more careful in how we handle infectious diseases. We're more likely to wear masks and wash our hands, and hopefully slow or stop this future spread of disease. Also, people tend to recover pre-pandemic levels within approximately 2 years after they've been exposed. The bad news is that stigmas still remain in the military. Members don't believe their answers are not confidential or that it won't negatively impact their careers, so they'll choose to either not participate or they will lie. Also, civilians are having a harder time coping with COVID-19 stressors. Loneliness, reinforced by social distancing policies, was highly correlated with overall negative affect. Hopefully, we'll see this going down as restrictions become looser. The limitations to this study are that we asked people to retrospectively assess the pre-COVID levels, and sometimes those memories can be inaccurate. Second, we had a low number of veterans in our sample. This prevented us from studying them as their own population and determining any differences due to returning to civilian life after service. Third, assessments of substance use is subjective. Recall can be hard when you've been drinking or doing drugs. And finally, due to time constraints and red tape, the survey was not able to be disseminated directly via the military, and we had to find our sample via Prolific. I believe we would have had a much higher participation if allowed to send it out via command channels. And last but not least, I need to thank Dr. Eisel, Dr. Farley, and Deb Carson for all of the amazing, wonderful help and mentorship they've given me these last couple of years. I couldn't have done it without them, and I am sincerely grateful for all of the work and attention they've given to help me learn this information and satisfy all my curiosity. Thank you guys. And then the rest of the pages are just boring references. I welcome anybody who has any questions to contact me. My email's on this last slide. I hope everyone has a wonderful day. Thank you for joining me.